Okay, this is chapter 12 from the same book. Let's see here. How to Improve Blood Flow. That's the subtitle. The regular title is A Tale of Two Toes in a Hot Tub. It's sort of a parody of the title from Jonathan Swift's book. We're going to talk about how to get better ICU outcomes. It's only one slide. It's a fast chapter. Basically, three of the main things you need for healing. You need to sleep. A lot of times the ICU is a tough place to sleep. The patient is seated upright in bed. How many people sleep seated upright in bed at home? No, we sleep laying down on our side, okay? So it's good to let the patient be able to lay down on their side if that's possible. The ventilator endotracheal tubes are not as bulky as they used to be. Hopefully the guy can lay on his side. And it's good to have the room quieter. There's no rule that says the TV has to be on all the time, especially with some stupid, obnoxious show with flashing lights and loud noises. Have it like, if you have to have it on, put an aquarium on there, or better yet, just turn it off. Ask the patient what they want if they're able to communicate. But they really need to sleep. Too many machines going bing, 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 that makes it difficult to sleep. Too many bright lights for any reason. Let the curtains come lower and let it be dark, okay? You don't want the blood pressure cuff going off too often. It can be surprisingly painful to have a blood pressure cuff going up on your arm. Yeah, if the guy's hypotensive, you might have to monitor him more closely. But I'm just saying, for random purposes, don't measure the blood pressure unless there's a good reason to do it, because it's going to make it harder for the guy to sleep. To heal, he needs to sleep. Try to avoid having unnecessary lines or tubes. If you need a line in there, nasal gastric tube, whatever it might be, you need it. But don't, have unnecessary lines and tubes if they don't have to be there. So if the guy can lay down flat, if their health otherwise permits that, they're going to sleep better, and that'll help them to heal faster. Be real nice to them. Try to make the patient feel happy and safe to the extent that's possible, because a parasympathetic mood will lower their cortisol, which lets them sleep more, lower their catecholamines, epinephrine, norepinephrine, same thing as adrenaline and noradrenaline. And so the person can relax and they can sleep more. That's why the really good senior physicians, they know how to behave around patients. Real nice, friendly, calm. Everything's okay. Mellow them out so that patient can calm down and get better faster. It's good to have a family member in the room. You always want to have a family member in the room if that's possible, because there's all kinds of little things that happen for the patient, and the family member knows the patient. They can help them out. For example, when my mother was in the intensive care unit, I stayed in the ICU. Same thing when my father was in the ICU, because I know them. I can help them with every little thing, especially my mom's always making jokes, and the nurse will think she's crazy if she doesn't understand her. So that can really be beneficial. Plus, all kinds of weird little things can happen in the night. A line can get pulled out, or the patient might try to get out of bed or something and fall. So having somebody right with them in the room, the family, is a very good thing. The family members should take turns. Healing from a serious illness problem, a lot of times like a marathon, not a sprint. And the family can kind of tag team, take turns to be with the patient and do everything they need to help them. Another thing too is it's amazing how few doctors know anything about blood viscosity and how to improve blood flow and how to improve oxygenation. It's actually, I think, kind of ridiculous. I did a surgical internship, plenty of time on surgical services, interventional radiology, thousands of cases. I never in my entire life, in all my time in medicine, ever heard a single lecture on how to improve blood flow. And that's the key to healing. It's simply not taught in medical school. And even general surgeons, like I said, I spent a lot of time around surgeons. I never once, ever, in 30 years of being a doctor, I've heard them talk about how can we optimize blood flow. And that's a real basic thing. It really should be a standard routine part of any surgeon's curriculum. Really, any doctor. Anything you want to heal. A fracture, a wound, a surgical site. You want good blood flow. And we all know, by now from watching my lectures, you've seen it. Low fat, because fat thickens the blood, sludges it together, decreases oxygen delivery to the tissues. It also causes insulin resistance, which messes up wound healing. Diabetes impairs wound healing. You also want to minimize sodium, because the sodium is a vasoconstrictor, and that'll also decrease tissue perfusion and can slow healing. Sodium chloride, dietary sodium chloride. The chloride, it can induce a little bit of a low-grade metabolic acidosis. You want to avoid the animal protein to the extent you can. That induces a little bit of a low-grade metabolic acidosis. Usually you don't want acidosis. And of course the plant food has fiber, so that helps prevent constipation. So instead of having to give the patient an artificial fiber, if they're eating the plant foods, they'll be getting fiber from that. So these are three things: helping the patient to sleep, being nice to them as much as possible, try to calm them down, get them into a parasympathetic, relaxed, low stress frame of mind, because then you'll drop their cortisol, their catecholamines, they'll sleep better, they'll heal better, and then do what you can to improve their blood flow. Make sure the area that you want to heal is warm, and that you do these other things to improve blood flow, and hopefully that'll help the patients to heal as well as possible in the ICU.